Welcome to Bipolar Talks, your go-to space for honest, raw, and thoughtful conversations about living with bipolar disorder. If you're new here, don't forget to like, subscribe, and share this episode with anyone who might need a deeper understanding of mental health, because here, we don't sugarcoat it. We get real. Today's episode is titled Depression in Bipolar II: What It Really Looks Like. Bipolar II is often misunderstood, even by those familiar with mental illness. Unlike bipolar I, where mania is intense and disruptive, bipolar II features hypomania, which is often overlooked or even praised. But the real storm? It's the depression. And it's not just feeling sad. It's debilitating. It's suffocating. It's lonely. We're diving into the lived experiences, the clinical symptoms, the day-to-day challenges, and the nuances that make bipolar depression different. Whether you live with it, love someone who does, or you're just curious, this episode is for you. So take a breath, find a quiet space, and tune in mindfully. This is Bipolar Talks. Let's start with some grounding. Bipolar II disorder is a mood disorder characterized by cycles of hypomania and depression. Unlike bipolar I, the highs, called hypomania, are milder. But the lows? They are often deeper and longer lasting. And here's the thing. Depression in bipolar II isn't just having a bad day or feeling down. It can manifest as total emotional paralysis. You're not just tired, you're completely exhausted. You're not just sad, you're empty. People often say bipolar depression feels like being buried alive. You're aware of everything happening around you, but you feel unable to move or react. Sometimes you don't even want to. Clinically, the DSM-5 outlines symptoms such as persistent sadness or low mood, loss of interest or pleasure in almost all activities, significant weight changes or appetite shifts, insomnia or excessive sleep, fatigue or loss of energy, feelings of worthlessness or guilt, difficulty concentrating, thoughts of death or suicide. But that list doesn't really feel like what people experience, right? So let's talk about how it really plays out. Have you ever had so little energy that brushing your teeth feels like climbing Everest? Or felt so numb that even your favorite song feels like static? That's the day-to-day of many living with bipolar depression. So what does it really look like? Let's dive deeper. One of the most difficult aspects of bipolar II depression is how hidden it can be, because it's not always dramatic or loud. It doesn't always come with crying fits or visible despair. Sometimes it's the absence of anything at all. Many people continue working or going to school. On the outside, they're functioning. Inside, they're falling apart. This is called high-functioning depression, and it's common in people with bipolar II. They may smile at meetings and meet deadlines, but the moment they're alone, they collapse. There's also the social withdrawal, not because they don't care, but because they can't. Conversations feel exhausting. Texts go unanswered not from rudeness, but because replying feels like lifting a boulder. And the guilt. Oh, it's thick. Why can't I just be normal? Why am I like this? I should be grateful, but I feel nothing. Then there's the suicidal ideation. It's a quiet, creeping presence. Not always loud or impulsive. Sometimes it's a subtle thought that whispers, "Wouldn't it be easier to not wake up tomorrow?" But even then, many won't ask for help. Why? Because they fear being seen as dramatic, or they think they don't look sick enough. That's the tragedy. People suffer in silence because their pain is invisible. Have you ever felt unseen in your depression? You're not alone. A key point of confusion is the difference between bipolar depression and unipolar, or major depressive disorder, MDD. They can look similar, but there are some differences worth knowing. In bipolar depression, mood shifts may happen faster. Sleep issues are often more severe. There may be a history of hypomanic episodes. Antidepressants alone can trigger hypomania or mixed states. The sense of inner restlessness, irritability, or mood reactivity may be more intense. The treatment approach also differs. Antidepressants are used with caution in bipolar II, often combined with mood stabilizers like lamotrigine or lithium to prevent mood swings. Psychotherapy, especially approaches like CBT and interpersonal therapy, can help, but the biggest challenge is getting an accurate diagnosis. Many people are misdiagnosed with MDD and don't realize they're bipolar until years later, usually after a hypomanic episode or a poor reaction to antidepressants. It's why proper assessment matters. Have you or someone you know been misdiagnosed before? It happens more than you'd think. Living with bipolar II depression means bracing for emotional whiplash. One moment you feel slightly okay, maybe even hopeful. The next you're back in the pit. There are days when emotions are intense and overwhelming. Anger, grief, self-loathing. Then there are days where you feel nothing at all. Just a hollow gray fog. And the hardest part? You remember what it feels like to be okay. You've had moments of hypomania, where things felt sharp, bright, energized. The crash back into depression can feel unbearable in contrast. It creates a kind of grief. Grieving the version of you that felt alive. Grieving the motivation, the creativity, the confidence. That contrast can be crushing. This instability can also make relationships hard. Loved ones may feel confused, helpless, or frustrated. But you were doing so well last week, they say, not understanding how quickly bipolar moods can shift. It's not about being unreliable or dramatic. It's a neurological condition. And it deserves compassion, not judgment. How do we hold on when everything feels like too much? Let's bring in some real voices. Here are excerpts from people who've lived through bipolar II depression. It feels like I'm underwater, watching everyone else breathe normally. I want to scream but there's no sound. I don't feel sad. I just feel gone. Like I've disappeared from myself. When I'm depressed, I cancel everything. Not because I don't care, but because I can't pretend. Sometimes I think about dying not because I want to, but because I don't want to feel like this anymore. Hypomania gave me wings. Depression cut them off. Each story is different, but the themes are similar: numbness, exhaustion, confusion, shame, and a desperate longing to feel normal again. Sharing stories helps us feel less alone. If you're listening and these stories resonate, you're not weak. You're human, and you deserve support. So what can you do if you or someone you love is struggling with bipolar II depression? First, seek a psychiatrist or therapist familiar with mood disorders. Accurate diagnosis is key. Second, know that medication isn't failure. It's chemistry, not character. It may take time, but with the right combination, many people find stability. Third, build a support network. Not everyone will understand, but find the ones who try. Peer support groups can be a lifeline. Fourth, have a crisis plan. Know your warning signs. Identify safe people. Keep crisis numbers on hand. And finally, practice compassion. You are not lazy. You are not broken. You are dealing with something real. And you deserve gentleness. From others and from yourself. Every low passes. Every single one. Hold on. Bipolar II depression is not just a phase. It's not attention-seeking. It's not weakness. It's an illness, and one that deserves understanding, research, and support. If you resonated with today's episode, please share it with someone. Let's break the stigma. Let's educate. Let's hold space for those who are hurting quietly. You are not alone. And if today's all you could manage was listening to this podcast, that's enough. You're enough. We'll be back next week with more insights, stories, and tools to navigate life with bipolar disorder. Please like, comment, subscribe, and share. It helps more people find us, and it tells the algorithm that mental health matters. Take care of yourself. Be kind. Be patient. And we'll see you soon right here on Bipolar Talks. Disclaimer: this video is for informational purposes only and should not be used as a substitute for professional medical advice, diagnosis, or treatment. Always seek the guidance of a qualified health provider with any questions you may have about your mental health.